Guys, welcome back to Medical Coding with Blue. Today's episode is all about explaining the medical coding certifications. Are the credentials with Ahima, the American Health Information Management Association, more for the inpatient and administrative side, and Aapc, the American Academy of Professional Coders, more for the outpatient side? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, I hear this a lot. People who will ask me, well, I know that Ahima is more for the administrative side and is more for the hospital inpatient side, and Aapc is more for the outpatient side. This is untrue. And why do I say this? Because both of the associations have credentials that are for the inpatient side and for the outpatient side. About these credentials, because each credential says something different. So I'm going to start off with Ahima first, and we are only talking about the medical coding certifications, not the degree designation certifications, because that has to be on a separate video. I only want to speak about medical coding because it is something completely different from what the degree designations do. That's number one. Number two, I tried to stay focused. So here we go. So Ahima has 3 medical coding certifications. The CCS, that is a Certified Coding Specialist. This credential says that you have mastered inpatient coding and outpatient coding. You can code anywhere when you have the CCS. You can code for inpatient hospital side, you can code for professional fee coding side, you can code for the outpatient clinic side, you can do anything with the CCS, okay? Because again, this credential says that you have mastered both inpatient and outpatient coding. This is the highest designation you can have in medical coding, okay? I'm just saying, okay? That's just not my saying. That's an industry known thing. I'm just saying. Number 2, the CCA. Now, the CCA is a Certified Coding Associate. This is entry level. It's considered entry level. It says it on the description of the credential, but I think that sort of discounts all the things that the CCA does. I had the CCA. That was the first credential I ever had. And that I held on to that for 13 years. You had to pry it away from me. And the only reason that I gave it up, it was because I have other things going on in the back that I had to move forward. And in order for me to move forward, I had to put the CCA to bed. Now, I stubbornly held on to it because a lot of people are very ignorant when it comes to speaking about the CCA. They say, oh, CCAs can't do anything and they're an apprentice. CCA is not an apprentice. The CCA stands for Certified Coding Associate. This person who possesses this credential has the most domains on their exam, okay, I will say. And with the CCA, you have to know inpatient coding and outpatient coding. So again, with the CCA, you can code anywhere. You can code inpatient in a hospital. You can code for inpatient, outpatient pro fee, right? Or you can code for outpatient clinics. You can code anywhere with the CCA. The CCA just says that you won't have any experience and that you have been, this is your first time in medical coding, and that you understand the fundamental basics of not just outpatient coding, but inpatient coding as well. Okay, so that's the thing about the CCAs. CCAs are highly capable people because, again, those exams with Ahima are very rigorous. All medical coding certification exams are rigorous, but Ahima has a reputation for being the most rigorous with their exams. So CCA is a wonderful credential. I will always advocate for the CCA because, again, I had it. And I will always talk well of it because I was able to change hearts and minds, and I was able to get hired with it several times, 4 different jobs with it. I'm just saying. So if you want to code inpatient or outpatient, you can start off with the CCA, okay? Now they also have the CCSP, the Certified Coding Specialist, physician-based. Now this is the mastery of the outpatient setting coding, okay? This only has outpatient coding. So when you take the CCSP exam, all you need is the ICD-10-CM book, the CPT, the AMA CPT Professional Edition book, and the HCPCS book, because this is what the CCSP is testing you on. Now the CCSP is all outpatient coding. You can code anywhere you want to with the CCSP except for It doesn't say that you have any training on ICD-10 PCS. However, if you go through a program and you learned ICD-10 PCS, but maybe you said, I'm not really confident in this, and everybody says I need to take the CPC because Ahima is only for inpatient positions and administrative work. Untrue, guys, untrue. You can take the CCSP, and the CCSP says that you have, again, mastered that outpatient setting, okay? That you know how to code with the ICD-10 book, the CPT, and the HCPCS, okay? So that's for that one. You can code outpatient clinic, and you can code anywhere you want to with that CCSP, okay? As far as like outpatient goes. Now, AAPC, the American Academy of Professional Coders, this is a separate organization from Ahima, right? The American Health Information Management Association. Separate. These are two separate organizations. Ahima is involved with the lawmaking process and everything. They are a non-profit organization. Now, AAPC, the American Academy of Professional Coders, they are a for-profit organization, which means they have a slew of different credentials for you to choose from, but their flagship credential is the CPC. That's the one that everybody starts off with majority of the time, right? Now, that CPC says that you know outpatient coding, that you know like the CCSP, it says that you know the ICD-10 the CPT, and the HCPCS. This is for the CPC. Now the difference, because they have two designations, two different designations for the CCS, the CPC. Sorry, for the CPC. They have the regular CPC, and then they have the CPCA. So CPCA means Certified Professional Coder Apprentice. Now, when you first get your medical coding certification with AAPC, and if you have no background in medical coding at all, right? And this is your first time into the field, and this is your first time out there, applying for jobs and things like that. You have no background at all again. Then you're going to start off with the apprentice status. Now, you have the apprentice status for 2 years, okay? And when you start working and you work your 2 years, you will have that removed. You have to get a letter from your employer, though. But this says that you have been working in the outpatient setting, because again, the CPC is covering outpatient coding. Now, when you have the standard CPC, again, this says that you have the knowledge and everything for coding in outpatient. It doesn't necessarily mean you have experience because AAPC, they're a for-profit organization. They have made a way where you don't have to have the apprentice designation for 2 years. You can have a full-fledged CPC credential if you go through one of their approved programs and you take Practicode and you pass Practicode. If you do those two things, when you finish, you'll have your complete CPC. You don't have to have the apprentice status, but you still have no experience. So I'm just saying. There's nothing wrong with being a CPCA. There's nothing wrong with carrying an apprentice status for 2 years because, again, you're getting your experience. Now, to get the CPC and have no experience, you paid more money for it, and you have just the same shot of getting in as everybody else does who has no experience as well. The only difference between you and them is that you paid more to be a full-fledged CPC right out of the gate rather than just a CPCA. And again, there's nothing wrong with CPCAs. They get hired all the time. I know because I'm a resume writer. I do plenty of resume rewrites for CPCAs, and they've been successful. With my resumes. It's not a guarantee, guys, but I'm just saying that it depends on what you're putting out. So that's that part. Now, AAPC also has the CIC, the Certified Inpatient Coder. Now, that credential says that you know the inpatient side, and it tests you on inpatient coding, okay? So, of course, you have to know ICD-10 PCS as well as ICD-10 CM. But with the CIC, again, this says that you can code for an inpatient hospital, type of setting, okay? So that's what you want to keep in mind. The two organizations put out fantastic coders, okay? There is not one organization that is better than the other one, all right? I will say that, even though I am a member and a credential holder solely with Ahima, I was going to say AHIMA, even though I have all of that with Ahima, I still talk about both organizations because this is what employers are looking for. So if you happen to say, well, Blue, my program is giving me a voucher so that I could take the CPC, then that's totally fine, because then that's what you have with that program, and you didn't know, okay? But keep in mind, with AAPC, they do require all of their members to be members every single year. You have to pay the $205 every single year that you hold your credential in order to have it. If you don't, they will revoke it. Ahima, the American Health Information Management Association, does not require you to have a membership. However, they will charge you when you are submitting your continuing education units, which you do have to report to maintain your certification. Okay, so that's a difference between them two. But whichever one you choose, there is a path on both of them that will allow you to say with certainty, I am an inpatient coder, I am an outpatient coder. Either one of them, okay? Either one of them. And this baloney about Ahima being only for inpatient coding only and admin coding only, that is not true, okay? Again, they have the CCSP, the Certified Coding Specialist Position Based. And I'm repeating myself a lot because sometimes people miss parts of the message. So I want to make sure that is clear. It's physician based. That P stands for physician based, okay? Just saying. But with that, again, you can code in the outpatient setting. So if your program says, okay, we are teaching and training you on ICD-10-CM, CPT, and HCPCS. We follow the CPC guidance so that we can prepare you for the CPC. But maybe that program doesn't pay for the voucher and you got to still pay for it out of pocket and stuff like that. You have a choice then. You have a choice with going with AAPC, or you have the choice with going with Ahima, with the CCSP. And if you look at the job listings, those are the ones that they ask for. The CCA, the CCS, the CCSP, or the CPC. So either way, you will be able to apply for these jobs. And if you end up getting a CCS or the CCA, right? And you say, well, I know I passed the inpatient ICD-10 PCS part, but I don't really feel confident in that part, but I would like to do outpatient coding. You can still do outpatient coding with the CCA or the CCS. I know because I had the CCA and I have only coded in the outpatient setting, okay? And so now that I have the CCS, I still only code in the outpatient setting, all right? But I wanted the mastery credential. That's what I wanted. And having my platform being here on YouTube and having my channel, I felt like it was also important that I show that I have this because, again, I know that people look to me for like, okay, well, can you explain this? And, having the CCA, I was able to explain a lot, but having the CCS and the CCSP has opened more doors because, again, the mentality of the CCA and people, the way that they look at it is not always the greatest thing. So that's why I'm trying to change that. I'm trying to promote more positivity about it as well. Because some people get it, but there's a lot of people that don't get it. And they speak like they know. They speak like they know, oh yeah, that's nobody asked for it. They do ask for it. You're probably looking under the wrong job title, okay? Which is what happens a lot of times, I'm just saying. There's nuances in the industry that you have to learn, okay? So don't feel pressure if you don't know which association to go with, and maybe the school's pushing you to get an AAPC credential, or maybe the school's pushing you to get an Ahima credential, but you just don't feel confident. Okay, then that means you got to still work on your coding. You got to start working on that. But just know that whichever association that you choose will make a difference in the amount of money that you are going to spend. Because again, Ahima will charge you to report your CEUs, but they do not require a mandatory membership fee, whereas AAPC does. Okay, so $205 in a 2-year cycle is $410 that you're going to have to put out, regardless of whether you have a job yet or not. Okay, hopefully you have a job within those 2 years. But if you don't, again, that's $410 that you just spent to maintain your certification. Not only that, the 36 continuing education units that AAPC charges for one certification, okay? And it goes up as you collect more. So if you wanted to get the CPC and you say, well, I want to get the CIC as well because I want to be able to do inpatient and I want to stay with AAPC, again, it's going to go up the amount of CEUs that you have to report, but you will have the 2 certifications. Whereas if you decide to have the CPC first, and then maybe you say, well, I want to get the CCS, you could certainly maintain the CPC if you wanted to. However, if you take the CCS and you pass it, you could always just have that one credential. And again, that's good enough to say that you have both inpatient and outpatient knowledge, okay? You do not have to double up. And having more credentials will not get you more money. And I want to talk about this because I think this is very important. In the first 2 years that you are becoming a medical coder, learning, getting your certification, and then you're having to work in those 2 years towards, your CEUs and everything else to be able to maintain it. In the first 2 years, all you need is one certification. And I'm gonna push this because it's not necessary for brand new medical coders. Now, when you have experience and you know what's going on in the industry, you're going to know that there are certain credentials that are valuable, yes, but they're going to mean different things. Like if you wanted to get into CDI is a great example of this. CDI is something completely different from medical coding. And if you're applying for a CDI position, naturally, then you're going to want to be certified for that. However, when it comes to medical coding, medical billing and coding, we are all tested on reimbursement. All of us. In the 4 main medical coding certification exams, they all test on reimbursement. Therefore, being certified for biller when you're in your first 2 years, again, is unnecessary because no one asks for billers to be certified, unfortunately. I think it's important for billers to know a little bit about coding, but the industry does not have that standard. The industry does not say that. So because of that, somebody who's coming in and trying to get experience in the medical coding realm, even though billing is not coding, but it's still giving you exposure to those codes and to the electronic health record and all that kind of stuff, that's very helpful to add experience to your resume, right? But that being said, avoid the trap of being told, oh, you have to have multiple credentials. I've seen that where people say, people who have multiple credentials make more money. BS. B, capital B, capital S, BS. Why do I say that? Because me having the one credential for many, many years and me outpacing salary-wise people with multiple credentials. All you need to start is one. That's all you need. But when you get out of those 2 years and you say, okay, well, now I know kind of where I want to go and what I want to do, and I want to do CDI or I want to do other things, that's when you can start looking at the more specific things, okay? But you do not have to be certified for specialty coding because, again, we're tested on all the specialties when we sit for these exams. So these exams say that we're competent to code all of these things, all right? So again, something different. If you're going to sit for an additional credential, make sure that it does not overlap with what you've already been tested on, because then you're going to be paying out more money. And I see people get so excited because they want to keep up with the Joneses. It's not about competing with other medical coders. The only person you have to compete with is yourself. Yourself from yesterday. That's who you need to compete with, not all these other people, because their race is not your race. They're running a different marathon than you. And so for some people, it's going to be a long haul marathon, and some people it's going to be a very short sprint, okay? But what they're doing is not what you need to be doing. What you need to be doing is making sure that you are educated and making sure that you are continually educating, because you don't have to have a bunch of credentials to say that you're educated. right? I'm just saying, because I didn't have a bunch of credentials to say that I had all this education. I just had my experience, my know-how, and I continued to build on it. That's the difference, guys. And so when you stop looking around at other people and seeing what they're doing, and then you're going to try to compete with them and get a bunch of credentials too, and for what? When you stop doing that, the world will open up to you a lot more, because you're not being distracted by these other things that you don't need to be distracted with. You need to focus, because trust me, the medical coding is enough for you to be focused on, which is learning all these things, because people with a slew of credentials are really good at passing tests sometimes, and sometimes they don't have the knowledge to back those things up. I talk about the viewer from a few months ago, maybe last year now, who said that they have 4 credentials. They still haven't been able to get a job, and they have a CPCA because their instructor told them that they needed to have multiple credentials to make more money. You make more money with knowledge, folks. That's how you make more money. Not about the amount of credentials that you have. And then depending on what you want to do, that's when you get degrees. That's when you get other credentials, like for CDI and going through ACTIS, the Association for Clinical Documentation Improvement Specialists, right? And so that's when you go through those things. Not in the beginning when you're trying to learn, okay? When you're trying to learn. Spend 2 years. I challenge you on that one. Everybody likes these challenges, right? Well, then I'm challenging y'all, if this is your brand new career field, to start with 1 certification and build on your knowledge so that you don't have to worry about all these other silly credentials right now, when your time really should be spent on studying and getting focused and moving forward from there. I'm just saying. That's just my advice to you guys anyway. So if you hear that, if you hear Ahima is all administrative and inpatient and AAPC is all outpatient, baloney, okay? Ahima has their outpatient credentials as well, okay? and AAPC has their inpatient credentials, okay? So their inpatient credential, you know. So that's just something that you got to know. Do your research. Go through the videos if you have more questions on the credentials, because I've done plenty of them. But yeah, do that. And don't always take everybody's word for it, okay? And so I hope that this video helps you. If it does, please like, subscribe, and share, and I'll see y'all next time. Bye.